One more minute? Okay. Good afternoon. My name is Winnie Yang. I'm the Unit 4 Sam Ginden Chair in Social Justice and Democracy at Ryerson University. I just start off want to thank everyone for being here. Today is the International Day for the Eradication of Poverty. And we feel it's a very good opportune time to just release our report called Working So Hard and Still So Poor. A public health crisis in the making, the health impacts of precarious work on racialized immigrant and refugee women. I want to start off by acknowledging the funding from the Center for Labor Management Relations, Ryerson University, and also the participation of 4 community partners, which include the Immigrant Women Health Center, the Tibetan Women's Associations of Ontario, the Central Toronto Community Community Health Centers, and last but not the least, Across Boundaries. And we've conducted a study with 40 racialized refugee and immigrant women. We had, through the community participations process, it's very much a community-based action research. We enlisted the help of the community partners and recruited 6 community researchers who themselves work precariously in different part-time jobs. And we trained them and they became our interviewers, the community researchers. And so in a sense, I just want to briefly go over some of the highlights and then we'll be asking the rest of the panel to speak. Out of the 40 women, I think what we are saying is that the precarious working conditions of what the women have to be subject to have created such a heavy toll on both their physical, emotional, and mental health. And the other piece is also what we're saying is that right now, through the research, we are saying that it's a public health crisis in the making. And through the stories, through the narratives of these 40 research subjects, the immigrant women, we are making it real that there's an urgency for both the policymakers, the community agencies, the academics to come together and saying we now have a crisis, public health crisis in the making, and something much more proactive, much more urgent need to be done in terms of changing the legislations. And part of the reason we're launching the report today is also taking into considerations that the special advisors of the changing workplace review are preparing its final reports. And so this, in a way, is also our recommendations and our pitch, too, as well to the Ministry of Labor, that some of these new recommendations need to be taken into account in the final reports that they're going to submit to the government. So I would like to first call on Estina Sebastian Guitin. She's one of the community researchers, and her poem is actually right in the foreword. And she personally, she would let you know she's juggling 3 part-time jobs at the moment.
Oh, immigrant and refugee women, why did you leave your native land? Was it to find a better life? What did you expect to find, my friend? Be prepared. Precarious jobs are waiting for you. Minimum wage or even less. No paid sick days or benefits for you. You'll be living below the poverty line. Unpredictable hours, it's struggling time. Welcome to survival jobs. Expect the unexpected. Depression and failing health. Family life is on hold. Inflation, discrimination, and much more. Solution time. Know your rights. Speak out. Let your voices be heard. Discover your strengths and overcome all challenges. Let's aim for a better tomorrow today. Hello everyone, my name is Estina. I'm a community researcher on this project. Listening to the stories of the various immigrant women, I realized that I was not alone in this struggle. I juggled 3 part-time jobs. One as a noon-hour assistant for 2 hours per day in a school during school time. And the other 2 jobs, I'm a healthcare / PSW worker. These jobs are through 2 temporary agencies. Mostly, my assignments are more on call, it's unguaranteed, not scheduled, and carries no benefits. Rushing to work after my lunchroom work caused my blood sugar level to drop and I start to shake. I feel shaky or nervous. I'm very stressed having to work late hours, especially on evenings, if I get work. And getting home late causes me to have restless sleeps. This is causing me to be sick and unstable in my family life. It affects my home life, the work that I do at home, and my responsibilities as a mother and a wife. One family member, to be exact, my husband, he had a heart attack this year, and he had to be off work for about approximately 3 months. I too had to be off work sometimes to look after him and to be with him at the doctor's office or in the hospital room. I could not work as before, and work was slow, and as you will know, money was also slow. I myself got sick approximately 3 years ago, and I went to work sick, and I got more sick. I ended up in the hospital. This was bad for me. I had a pneumonia, and I was off work for 1 month. This affected us, my children. I couldn't meet the needs of my children and my family anymore. So this is why I'm here today. This is why I was interested in doing this research, to see if there are people out there who are just like me. And what did I find? I find all the persons, all the participants were exactly in the same shoe like myself. No paid sick days, no precarious jobs, carry no benefits, and when we don't work, we just don't have money to go by and to carry and to meet our needs. So that is why I am here today, expressing what I have, all my concerns.
Yeah. Well, thank you, Estina. We'll now turn to Professor Jen Poo, the Associate Professor in the School of Social Work and one of the research team member. And I should just also acknowledge Professor Sadef Aratkot, who from the Department of Politics and Public Administration, she's also been one of our team members.
Thank you, Winnie. Good afternoon, everyone. I think Estina said it best. This is pressing, this is real, this is cutting short and changing people's lives. I'm here today and on this project because I thought I knew a little bit about immigration. My family came to Canada in the 1970s. My mother's credentials were not recognized in the same way, and we had to do some starting over. I thought I knew a little bit about health and mental health, having studied so long and got those degrees that are needed to be in academia. And I thought I knew a little bit about the link between work and health. And we've referenced some folks in the report who write about this at the Institute of Work and Health, for instance. But I did not know how difficult, how much of a crisis this is until working on this project. I did not know how important this report would be, how important this little project with a tiny amount of money would turn out to be, and how pressing the issues are. And let me tell you why. The key message in this report, and I laud you, I implore you to look at this report, is that if you are a racialized immigrant or refugee woman working in a precarious job, so we're talking shift work, we're talking overnights, we're talking little control, we're talking little sleep, lack of awareness really about how long this will be and how much you can take, then you will get sick. It's not when, it's not if, sorry, it's when, and to how much, to the degree. So physical health complaints, Estina has shared some of those with you. We want to add diabetes to that. We want to add heart disease to that. We want to add circulation issues. We want to add cancer to that. I want to implore you to look at the section of the report where people are postponing visits to doctors because they do not have sick days, and they know that if they take a day, they will be fired. So they have not had the tumor that they know is in them looked at. They are postponing hospital visits. They are postponing operations. They are going to work again after a very long shift, 2 hours later, knowing that they just passed out on the way. And they are dealing with the consequences of that. Again, if you are doing precarious work, your mental health will be precarious. This is a very clear message from this research. And you will feel depression. You will feel issues with the mood. You will feel anxiety. It's not if, it's when. And that will absolutely affect your family. So we're not just talking about racialized immigrant and refugee women's health, folks. We're talking about their families and an entire community of people, multiple communities. Our research really only scratched the surface. With a little bit of money, that's what you do. You do the best you can. But this is a public health crisis in the making because it's multi-sector, right? It's multi-issue, it's multi-community. And we often think about public health crises as contagions. You know, some of us might think about SARS or, hepatitis C, for instance. But there are environmental crises as well. And this is a social and physical environmental crisis for women working in precarious jobs. I cannot stress this enough. And I personally feel like there is no more time to be wasted. There's no more discussion to be done. There are no more reports that are necessarily needed on that. There are other folks who have been working around these messages for a long time. The time is now. Thank you.
Thank you. Now we'll turn to Ziring Pendon, who's another community researcher and came in as a refugee from Tibet via Nepal. So, Ziring.
Good afternoon, everyone. My name is Ziring Pendon, and I'm one of the community researchers for this project. The women that I have interviewed have all shared their experiences working precariously and its impact on their emotional, mental, and physical well-being, as well as their families. They are mostly from PSW and food processing sectors. Some of them work up to 16 hours a day or 16 hours a week. There is always the uncertainty in their job. They are all underpaid with no benefits. As sickness is inevitable with bills to pay and families to feed, they have no choice but to go to work even when they are sick. So this is a public health crisis. Not only are they sick, they are making their co-workers and their clients sick who are already in a vulnerable situation. So I strongly recommend at least 7 legislative paid sick days for all of us. As a woman and as a mother of 2, I say it's only fair to have paid sick days for all of us in Canada. To sum up, I would like to quote one of the participants who work as a lunchroom supervisor at a school. I quote, "I feel like I have to be there no matter what. At the school, I had the flu and it was winter. I went sick every single day. I had bills to pay. But when my child is sick, I have no choice but to take time off. As a single mom, it's on me. Life is a struggle. Rent is so expensive these days. If you're sick, you had to stay home without pay. Nothing is coming in. You're weighed down. No benefits, no income. It's not fair," unquote. Thank you.
Thank you. So there you have it, some of the personal stories here. What our research has done through the narratives and the richness of the conversations with the women, particularly in the food service sector and the personal care sector, is confirming what some of the other research have said, that precarious employment is detrimental to poor health. And what we have done is add more texture, more color to this propositions. And we term it called the element of precarity capture. Basically, the women are in a positions where there's limited choice. The precarious life leads to precarious work, leads to precarious health. And eventually, it's going to affect the whole community. Through the report, it's impacted on their children, on their family, and their other, as well as the recipients of the care, particularly in agency workers. And so it's in that sense, and I mean, we are also seeing, I think Estina talked about juggling, waiting for calls, and a lot of the women are waiting for the calls 24/7 for the agency to call and give them those hours. It's one of the women in the research has said, who has been here for 25 years. And she's stated quite indignantly that for the last 25 years, she has never had a full-time job and never have a predictable days off, right? And those are some of that sentiments that we want to make sure that it gets across to the public. The other piece is also, Estina talked about the agency work. We now have temp agency sort of as the new norm in workplaces. And to us, I think what it has ripple and serious consequence is on the lack of access, particularly by agency workers, to occupational health and safety protections, to workers' safety, WSIB protections and claims. And to me, I think those are some of the recommendations we're calling forward as well. And what we have done is linking all the captures, trying to alleviate and making, particularly on this day, on October 17th, the International Day for the Eradication of Poverty, it's how do we make decent work real, right? So we put forward 5 different sets of recommendations. One set is addressing the physical and mental health and well-being of all women workers. How can we alleviate some of those situations so they are not so pressed and so stressed? The other is, as a public health concern, that how do we restore the quality of care and service in the system, particularly for those who are the recipients of some of these agency services? When you have a care system, be it long-term care facilities or private homes, where everything is piecemeal, or group homes, everything is piecemeal. All the workers kept changing on a week-to-week basis, where there's no relationship that can be built. How can we make sure that there's more accountability in this care system? And then the other set of recommendations is address economic injustice. And one of the other two pieces is tackling the increasing complex system. How do we tackle the agency system, temp agency system? One of our participants actually came out in a focus group saying we should smash temp agencies. And her quote got a lot of resonance. Everyone started clapping. And then the last but not the least, what we are also finding is there's a second generations that this cycle of precarity and poverty actually is now extended to the sons and daughters of immigrants and refugee women, right? So we have 3 younger participants who are under 30, university graduates, watch how their parents struggle, and now ending up holding 3 part-time jobs themselves. And to me, I think that has everything to do with the racism, the anti-black racism, and some of the anti-Muslim racism that's going on. And so we also have a set of recommendations. And here I just want to highlight a couple of the recommendations that we think it's important, particularly for the special advisors to take notice. One is definitely we support the call by Workers' Action Center, and Dina and some of the others are here on the need to raise the minimum wage, the 15 and Fairness campaign. We are also we put forward the recommendations also saying there needs to be decent hours of work. It's one thing to raise the wages, but people need to have certain hours to survive, right? We can't afford for women keep rushing from one workplace to another and paying one bills from another to another. So we are pushing, saying that there should be increased minimum reporting payment to 4 hours. Sometimes agency workers get called in and they get canceled with nothing, and there should be a minimum 4 hours pay. The other piece, and reflected quite clearly from Estina's narrative, is we need scheduling to allow stabilities. And we're saying for any agency work, there needs to be 2 weeks notice to provide some stability so people don't have to wait by the phone all the time. And then in terms of tackling the temp agency work system, we're saying employers, the client companies who enter into contract arrangements with temp agency workers should be equally held responsible for all liabilities, right? Be it the injuries, be it in violations, or wage theft, they should be held accountable. They can't hide behind agencies and just turn a blind eye to maximize their profit. So it's in that sense we are saying that should be front and center, right? And part of the recommendations. And then last but not the least, equally important is a strong enforcement system from the Employment Standards Act. So and those are the key points that we want to highlight. We're now to open it and turn to the media. Please feel free to ask your questions.
The study that you guys put out today was brought up in question period, and the labor minister said that, they're going through all this consultation with changing workplaces, and he's looking forward to, discussion. You guys have sort of talked about this being an urgent and pressing matter. Do you think that the government should maybe pick up its heels on this case?
Yeah, I think the government, the changing workplace review, it's one of the avenue strategies. But we, in the recommendations, we are also putting forward that actually the government needs to take an urgent review on how care is being delivered within the health, particularly within critical care like healthcare sectors, right? It's how it impacts on the women who are the personal support care workers, the group home workers, as well as how it impacts on the quality of care. And my sense is we want the government to do the consultations once the changing, and I guess go back to, once the changing workplace review recommendations is out, we want to see very concrete actions and a timeline. You cannot do, to make sure that the recommendations don't stay on the shelf in the report. You can have a beautiful, really written report, but what's the implementation plan? And the urgency in underscoring through the report is saying this is an issue that can't wait any longer. Thank you. Any comments? Estina, you want to say some more? What do you want the government to do? Actually, that's a...
We had that conversation.
I can say a few words.
Yes.
Like Winnie has stressed, these agency temp workers, they rarely take advantage of the new immigrants who are already vulnerable, facing a lot of struggles, unlike other workers. When they first come in the country, they have language barrier, they have immigration issues, status to work on. The main focus is to get the status here in Canada, especially for the Tibetan immigrants, refugees. So having all this struggle and then having family back home, having to think not only about your status here in the country, but how to bring the rest of the family here to Canada, and then working through these temp agencies, they go through a lot. And it all starts as a temporary resource for them, but then when we did the research, or not only the research, it's in the community. It's like an open community secret. People get stuck there for years and years with no raise for 14 years, no raise and benefits for more than 10 years. So these temp agencies, I strongly recommend that there should be some kind of a government interrogation or government review on these temp agencies. Not only do they take advantage of these immigrants who are vulnerable, they exploit them to the maximum. And then, as we have stated in the report, not only do they underpay the employees, they also take away a share of already underpaid wages from these employees. And then when they ask for sick days, they ask not to come back to work the next day. So because of all this fear and uncertainty, people don't have choice but to keep on going, keep on pushing. So this is the true story of refugee women.
Okay, I want to say something. I want the Premier, the Minister of Labour, Minister of Health, and all those in authority to take up my challenge. And my challenge is to live in my shoe for a week or a month. Live in my shoe in precarious job, in a job that takes me below the poverty line, and live with my income for 1 month or 1 week. And if it works for them, then well, all well and good. But if it not, then get back to us and say if we are making a just cause today, if it is justified.
Yeah, and I guess part of the urgency to the core is saying we need to break this cycle of poverty and precarity, and it has, because there is serious public health consequence here as well. So, yeah. Questions, comments? Yeah.
So the report highlights 40 narratives from women precarious workers, and I just wanted to know what message do you hope people reading the report take away from reading those different narratives?
That they matter. For every narrative that's in this report, there are thousands that are not, right? This is just scraping the surface of the issue. We did what we could with a very small grant, and we're very grateful for that grant. But this is the tip of the iceberg. This is why it's a public health crisis, because it's not just in Toronto, it's across this country. it's across this continent. We want folks to sit up and take notice, to think about the nail salon worker who's sitting across from you, whose baby was stillborn, who's not going to complain because she's going to lose her job. And the courage of the folks who did talk to us, who did talk to the community researchers, who are also now living in fear about what's going to happen, that they spoke up. And all the folks who aren't speaking up. I really believe this is the tip of the iceberg. I'm concerned about this. And more than ever, health. If we can live with precarious work, I ask, can we live with such precarious health for so many?
Just building on that too is, I think the other key message is saying, what Jennifer is saying as well, is that through the study, we want more people to read the report and get indignant.
Yes.
Of the working conditions that some of our fellow citizens and people that work with us are enduring on a daily basis, and make sure they send some of these messages to the MPP, to the MPs, that things are not fine, and that for just on October 7th we celebrate the International Day for Decent Work. Let's collectively work on making it real, and I think this is, it's. To me, I think we want to, I guess this is part of this report is also part of that effort in saying we want to build a society where no one needs to stand alone or left behind. Mm-hmm. And in that sense, we are each other's keeper. So an injustice to one is an injustice to all. And we need something done urgently and concretely and no more wait. Thank you. Yes.
So this news report is based on the 40 immigrant women that you collect information.
Yeah, we interview 40 women. 18 of them are Tibetan refugee women, 12 Chinese, Korean women, and then 8 black women from Caribbean and African continents. It's in the report here.
In this 40 women include 12 Chinese women. This 40.
Yeah, out of including yes, 12. Yeah. Unfortunately, a lot of them couldn't make it today, and part of either because of work or because of fear. They don't want to disclose their name. They don't want to be seen for fear that their employers would take them out.
For this woman, it's in the Greater Toronto.
Yeah, it's in Toronto area. Thank you.
This situation already extended to the second generation. So how serious is that? I think it's more hurting than...
Yeah, so I think with our report, we're signaling that this is an issue, right? If we take a look at a lot of our university graduates right now, they go out, carrying a heavy university, post-secondary education student debt, and what they're doing is looking for part-time, serial, temporary work. And to me, I think that's part of our call here is saying we need a larger scale study. I mean, it would be that would be part of the recommendations, but also we need to address some of the root cause of the problems to make sure employers hire directly and maintain some stability and the quality of work for all the younger graduates, younger generations, whom their parents struggle and sacrifice so much, so they could end up with a better life. And what we are finding, unfortunately, that has not been the case.
There's a piece in the report which affected me greatly, where a woman speaks to the fact that she works so much and so many long hours that her daughter now refers to her as her stepmother. the relationship has been broken that much. And it's not by the choice of the mother. The mother is doing everything that she can to work, to make the money, to make the rent, to hold half the sky. That is the quote in the report. And it's still not enough to be able to maintain that deep connection that you need for your health. The social determinants of health research has long said that the quality of your relationships will affect the quality of your health. And we cannot divorce the issue of work from health or health from work here. And that quote in particular has stayed with me for a long time.
Similarly, my daughter, she too, we don't have a good relationship because of that. She thinks I'm never home. When I am out working, they are at home or they are at school. When I am at home, they are all sleeping. We don't ever meet. One day my son said to his dad, "Dad, she's not here as yet. It's 1." He would wait up for me every night to come home. It was 1 in the morning. He said, Dad, she's not here as yet." Dad said, "Son, go to sleep. She's not coming tonight. She is working a night shift." Every night he would wait for me, and when it is 1:30, when he sees me come through the door, then he goes to sleep. And he said, "Son, go to sleep now, because she wouldn't be coming home tonight. A mother not coming home tonight." It was touching. It was very touching.
And no other questions? Then the panel, other speakers here available for individual comments, and some of our research colleague and Dina Ladd, Beishi from Workers' Action Center would also be available for comments. And we want to acknowledge and thank everyone for coming. There are some of our research participants here, and also want to acknowledge Sherry DeNovo, MPP from High Park. Sherry.
Shirley.
Yeah, Sherry. Yeah. Thank you very much.
Thank you.
Okay. Thank you. Good.